I think that, and I love this quote, our goals should at least be as big as the problems we're facing. And I think in conjunction with that, the way we work and the way we co-create and collaborate has to be as aggressive and as creative as how the problems we face evolve. And that's what I think today is. And that's why I'm so excited that you did this. That's why I want to congratulate Table to Table for doing this. And that's why I want to thank all of you for being here. And then, show of hands, how many of you work in a frontline organization that's currently serving people? Who are you? How many of you are on the front lines? How many of you are serving exponentially more people now than you were even at the height of the pandemic? Show of hands. All of us, let's give each other, and I'm going to give you a round of applause. Take everything I say with a grain of salt, except this. You're heroes and don't ever forget it, right? I used to not be able to stand in my power as a nonprofit executive director and claim that I was trying to do good and that I'm somebody that people should recognize as doing good for no reward and no acclaim, right? You need to claim that. You need to be proud of that because we see you as a state, and I'm going to make sure that the state sees you for as long as they don't kick me out of Trenton. But you need to claim that. I have 3 goals for today. I know a lot of you, a lot of my friends are in the audience, a lot of my partners. Hi, friends. Some of you have not. So what I want to do, and how long do I have, Heather? An hour, right? Just kidding.
Hour and a half.
I have 20 minutes. I'll fit it in, I promise. I'm going to do a little review of my office, but I'll also summarize my office for many of you that have never heard me speak before, those that I have not had the pleasure of working with. And then I want to go into 3 very simple, but incredibly crucial and incredibly hard steps that we all must collectively take at our individual organizations in order to connect food security work to health. And then finally, I want to take a moment to remind you all, 1, that you're important, but 2, to remind you that a radical dedication to your self-care is incredibly important in the work of connecting food security and health, in the work of creating food security for New Jersey. And if this talk stinks, blame Heather. So first of all, my name is Mark, right? I'm the food security advocate for the state. This office was created through legislation, so it's permanent. Ha! Can't get rid of me. Can't get rid of me. Right, it's on camera. This was created through legislation in 21, and I took office in 22. But really, we started doing this work in January of 2023. And actually, if you'll permit me, let me take a moment. I was reflecting personally. I find it fortuitous that we're here, in this kind of a setting. My father is the one who really informed my work and how I do this work. And he passed away right when I took office. I remember one of the things that he imparted to me is this Latin saying, ad maiorem Dei gloriam, do everything for the greater glory of God. And he used to tell me all the time, do it better than me. You are required to do it better than me. So I just love that, we're in this setting. I'm kind of reminded that, I feel like he's here with me. So I took this job because I felt like I could move the needle from here, and I felt like I needed to, I wouldn't be able to live with myself if I didn't try to move the needle from this job. Because what is this job? This is currently, and I hope that many other states follow suit, this is currently the only food security advocacy office in the country that's based in the governor's office. I report to nobody else other than the governor. So not only can't they get rid of me, right? I only have one boss, right? So it is a tremendous opportunity for me to make change, to get into good trouble, and to really lift up, the work that you're doing. I truly believe one of the things that I can do through this office is build consensus about what food security work actually means. And then drive you all and inspire you all and support you all in building collaborative efforts for that food security work. This is the definition of food security that my office is using, that I am using to build out this office. That food security exists. I remember this by now, right? I've said it so many times. True food security exists when all people, at all times, have physical, economic, and social access. Right? Physical, economic, and social access to safe, sufficient, nutritious food for both dietary and cultural preferences, for both an active and healthy lifestyle. I'm sure it hasn't taken many of you long to realize how much more expansive, holistic, inclusive, upstream, and incredibly hard this definition of food security actually is, right? This is a 6-dimensional approach to food security. I'll just read them off, but I won't go through them, right? Don't have time for that. You could do an entire conference around this. There are 6 dimensions that are interconnected, interdependent, and interrelated that factor into this definition of food security. Agency, sustainability, stability, access, availability, and utilization. Suffering, a disparity in one of these dimensions creates a high probability of an individual, a family, a community experiencing food insecurity. This is harder to do. This takes all of us. This reminds us that this work, that hunger and poverty, is a public health and an economic mobility issue. This is a public health and an economic mobility issue. And we have to, these stats that I'm about to read off should disturb us, right? Because recent data that's been released shows us that for all of our vaunted efforts, and many of you have been on the front lines of this, and I was with you on the front lines of this, especially at the height of the pandemic, we've been fighting food insecurity together, collectively, through our blood, our sweat, our tears, our funds. And yet, for all of our vaunted efforts, food insecurity has gone up, and a little less than 1 million people in 2022 experienced food insecurity in New Jersey. Food insecurity in New Jersey went up between 2018 and 2022 from 8.7% to 10.7%. We must do more. I want to give you all just a brief insight into where my office focuses our work. We have 4 focus areas. I work with state agencies. I work with both the governor's office and the legislature on policy. We work with the philanthropic community. So if there are any funders in the room, I'm coming for you. Because if they're going to collaborate, you're going to collaborate too. Right? And then also being present as much as we can in community, being at events like this, but especially going to a lot of site visits. We spend a lot of time out on the road. And this is especially what you can expect from OFSA in the next 12 months. I think the 2 at the top are the things that I'm really focusing on. Drawing down federal funds. We're terrible in the state of drawing down federal funds and leaving federal funds on the table. We leave millions. We rank near the bottom of the barrel in the United States in terms of drawing down federal funds. We're at the top in terms of paying into the federal government, right? But we're at the bottom in terms of drawing down. So my office can help with that. But then also innovation and infrastructure for our agricultural community. And this is actually a very big day for CUMAC. I just can't. Just, sorry, man. I reference Eva, I reference CUMAC. I'm just in Patterson mode. It's Joey's fault. Joey's back. I'm just being taken back to it. So it's a very big day for OFSA because today is the launch of our website. So for all of you that are holding your mobile devices, I'm going to ask for a kindness, and I'm going to ask you to scan this QR code. You should be able to scan it from here. If you want to know in detail what we've been up to in the last year, scan that QR code, go on the website right now. All of the funding that we've identified that you can compete for, all of the publicly available data that you can use to put into your grants, to put into your programs. We've put it all in one place for you. All of the research projects that we're doing, some of you are participating in them. If you want to know what we're doing in terms of research, you can go on there as well. But this is what we've been up to, and this is where you can keep track of everything we're doing. And for all you comps people, the QR code on the farther side, if you want to give us a shout out and put us on social, that's the QR code you use. The problem we're trying to solve for is not how do we feed poor people. That is not what we're trying to solve for. And that is especially not what we're trying to solve for in New Jersey's food security work. We have proven to ourselves, time and time again, and over and over and over again, that we can get food into underserved communities. We have proven to ourselves that we can do this. And we can also do an entire conference on the difference between seeing a poor person and a person living in poverty. Right? So the problem we're trying to solve for is not how do we feed poor people. The problem we are trying to solve for is here is all of New Jersey's food. And here are all the families that need New Jersey's food. How can we build an equitable system in the middle that makes sense for everybody? For everybody. So that that food gets to the families that need it. In order to build that system, we have to do some of these things. We have to focus on organizational health and organizational culture. And there are three very simple but very hard things that we have to do. First one, oldie but a goodie, especially for all you research and eval folks, you public health folks. You've seen this time and again. This particular slide that I keep using is from the Institute for Clinical Systems Improvement out of Minnesota. This is what determines if we're actually healthy people. If an individual, a family, a community is going to be healthy. You can see that very little of it, only a fraction of it, is actually connected to the food that we take in. To make the connection between food security work and health, if you are truly disturbed and moved to action and want to respond to this call to action because food insecurity is rising, the first thing you have to do is challenge yourself every day to ask, what is my organization's role in positively affecting this? And bonus, is my organization negatively affecting this? We must have a radical dedication to consistently and intentionally looking at our organizations and our programs and asking, are we affecting this? Because if we don't, the number just rises. And you guys on the front lines are just going to serve more and more and more people. That's the first hard thing. I propose one of the easiest ways to address the first hard thing is the second hard thing, is to climb the resident power ladder in partnership with your teams and with the people that are coming to you for help. Let's challenge ourselves to stop calling them our clients. They're people. There's no them or us, there's only us. Right? And can we climb this ladder together? This is from the Asset-Based Community Development Institute out of Chicago. The goal is to climb the ladder. On the bottom rung is residents as recipients of our services. Hi, how you doing? You need some food? Here you go. Bye, see you later. Hi, you need housing? Here you go. Here you go, right? In Jersey. Hi, you need SNAP? Yeah, you need your sign up. Here you go. See you later, right? You start to climb the ladder when you say, hi, how you doing? How are you today? What do you need? Today I see you. How can I help you? Am I doing a good job? Are we doing enough? What more could we be doing? When I started at Kumac, we started asking our clients in multiple languages, how are we doing? And we found out things like some of our clients didn't like our food and had Kumac corners in their very small apartments for all the food they didn't like. And some of our clients started to talk about and started to share with us how they throw food away, the food that we give them. That's residence as information sources. But when you listen and you start to act based on what people tell you you need to do to get better, they become your advisors, and then one day they won't need you anymore. And that is a beautiful thing. That's how we know that we have positively affected social determinants of health. If one day people that are coming to us do not need us anymore. That is the fixed point, the North Star of food security work. That is liberation from poverty and hunger. And you have a role to play in that. One of the easiest ways, but hardest, sorry, that doesn't go together, that we can climb the resident power ladder is by building safer spaces. And I told this to one of my former employees, making somebody feel safe. Safe is a heavy word, man. It's not just like, oh, I'm not going to get punched in the face at this organization, right? It's not safety from like physical harm. Got a reaction to that, right? It's more than that. Here's my definition of creating a safe and healing space. I think all the time, I have a 3-year-old. I love her to death. I know I would commit murder to feed my child, right? I would do anything for her. I would move heaven and earth for her. If I ever got to the point where I couldn't buy eggs for her, I would feel like I'm failing. Creating a safe space, a healing space, is creating a space where when somebody comes to you, they feel like it's okay to say they feel like they're failing. They feel like it's okay to tell you about what they need, to tell you their story. You ask and you listen. And guys, this one is the hardest. I'm a trendsetter, so I know this is hard. Hunt for the good in every person and in every day. Not meander, not browse. Hunt for the good with great intention and with great purpose for the good in people. This work be lonely, man. This work be lonely and frustrating, right? And you gotta force yourself to hunt for the good. But that's how we get to building healthy spaces. And I want to leave you all with this. Everybody take a breath. And out. Take a breath. And out. One more. Take a breath. And out. Hundreds of people today are coming to your organizations, and they're not going to have the opportunity to do that. And they feel like they're failing. You are blessed to be here today. I am blessed to be here today because we're all able to take a breath. A couple of really important things. Hurt people hurt people, but healed people can heal people. Right? If we are not able to practice a radical dedication to self-care, it will be very hard for us to convince others to take care of themselves. It will be very hard for us to convince people to eat healthily if we are in a state of stress. If we do not understand and appreciate and respect how critical this is. Many times you are called today, you will be called to be superhuman at your organizations. But before you can be super, you must first be human. And being human means giving your teams, your organizations, the opportunity to see you and for you to see them. Board members, they're in the back?
Yep.
This applies to our boards as well. Funders. This applies to our funders as well. Nobody is exempt from the requirement of respecting and appreciating self-care in the work of connecting food security and health. I'll skip this one. Just look at this real quick. You gotta be a little bit insane to be a nonprofit executive director. Can we all agree?
Yes.
Clap if you agree. If you want to be a nonprofit employee, you gotta be a little bit insane, right? Right? But there's good stress that drives you to make a difference, to make change. Good stress. You live for that game. You live for that hunt, right? That's positive stress. Chronic toxic stress. Chronic toxic stress is prolonged activation of stress response systems and the absence of protective relationships. The most critical thing that your organizations can provide to somebody today who feels like they're failing is a positive, supportive relationship where they feel safe and they feel seen. Do not discount how important that is for creating food security work. My last slide. Have a radical dedication to deep self-care. Reading a book ain't going to help you. I mean, it will. But deep self-care and a radical dedication to deep self-care is a commitment to listening to what your mind and your body are telling you. It is a growing capacity for radical self-compassion. If you are not able to be kind to yourself and your teams, I promise you, the families that are coming to you for help will have a very difficult time getting more from you than the food that you're providing. Be fed today. And when you meet each other, don't just talk about, hey, can you help me with this? Hey, I need money for this. My challenge to you all, when you meet each other today, and thank you again, Heather, for giving us the opportunity to do this, say, this is the power I bring to the table. Here's what I offer into this. What can you offer? How can we work together? That's what collaborative multi-sector food security work looks like. And the reason I move on stage and I wander is because I actually don't like people. Whenever I have to go around a room like this, I have to apply clinical strength antiperspirant to my bald head. Right? This stuff is strong. Like if I put it, like I could like combine bricks with this antiperspirant. Right? But when you move, right, you get your blood flowing. Right? This is what movement looks like. Right? Practice this. Have a radical dedication to practicing this. And all of this is hard, but it is needed and necessary. And you are necessary. Because the problems are getting worse. And the state needs all of you for this. Because if not you, then who? Thank you.